Hello, everybody. Good afternoon or good morning and welcome. This is Eunice Mathis with Florida Training Academy, and we're going to finish the practice test from yesterday. We have about 30 more questions to answer. Hello, Tabby. Hello, Renez. We're going to get started shortly, so we'll give you a few more moments to join in and let's review some practice CNA questions. I hope everyone's having a great Friday. All right, so here we go. Let us begin. Question number 41. What is the normal range of blood pressure in an adult? Is it A, systolic of 60 to 90, diastolic 60 to 140, B, systolic 100 to 150 with a diastolic of 60 to 90, C, systolic 140 to 160, diastolic 80 to 100, or D, diastolic 100 to 140, systolic 100 to 140 with a diastolic of 50 to 80. So, do you know your normal ranges for an adult blood pressure? And we'll be revealing the answer in three, two, and hello, Radical for Christ. Hello, Vanette. Great to hear from you again, Vanette. The correct answer is D. So, whenever you put the systolic over the diastolic, a blood pressure that is 100 over 50 up to 140 over 80 is considered the average range in healthy adults. If it's abnormal, you're to report that to the nurse. So when the blood pressure is low, we call that hypotension. That's when the systolic is less than 100 and diastolic less than 50. If it's greater than 140 over 80, we consider that hypertension. And for those of you all who are studying for your nursing exams, the numbers change when you're in nursing school. So when in nursing school, go buy your nursing book. But for your CNA exam, this should suffice. Question 42. What do you call a device that is used to take the place of a missing body part? A, brace, B, hand roll, C, prosthesis, or D, none of the above? And if you were here yesterday, you know this answer. Yes, 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 yes. And Leisha, I've not seen you here before. Hey, Beverly. Hey, Harona. So if this is your first time here, please let me know where you are tuning in from. My name is Nurse Eunice. I'm in Jacksonville, Florida. And our next video will be aired on Monday. So this weekend I have CNA classes, in-person CNA classes. So I won't have a video for you this weekend. But see, a prosthesis, such as an artificial arm, would take the place of a missing arm. And some of your patients do have prosthetic limbs. Question 43. Exercising each muscle and joint is called A, range of motion, B, rotation, C, abduction, or D, adduction. Hi, Anna. Beverly, Tabby, Anna, great job. The answer is A, range of motion. And before I go any further, whenever you think about abduction, think about taking something away. If someone's being abducted, it's going away from the body. Adduction means to bring the extremity closer. And there you go, range of motion exercises. And so once you have your CNA license, if you're interested in being a physical therapist, that is another career path that is, in demand in the healthcare field. Question 44. If there is a fire in a resident's room, the CNA should first A, open the window, B, put out the fire, C, call for help, or D, remove the resident. Hey, Ruby, I need you to think about race. Anytime there is a fire, the acronym you want to consider is RACE. Jartu, Tabby, Joseph, Vanette, yes, you all have it. The R in RACE stands for remove. You want to get that patient to safety. And so I'm going to put it in here. So RACE stands for rescue. That means removing the patient. And then after that, you can pull the fire alarm. And then you want to confine, that's closing the fire doors. And you either want to extinguish or exit the building. So if you cannot put out the fire, you exit the building, but get your residents to safety first. 45. Which of the following is not considered a stage of dying? A, bargaining, B, anger, C, acceptance, or D, none of the above? Beverly, Anna. Yes, you all, great job. All of those were considered parts of the stages of dying. Whenever a person gets to the final step, C, acceptance, that is when they would usually consult hospice. So they were assigned a DNR, a do not resuscitate form. And so all of the answers that were provided are the stages of dying. And as a CNA, as a future nurse, you help your patients go through this grieving process. Question 46. Where would you find the carotid pulse? On the wrist, the ankle, the neck, or the groin? The carotid pulse. Yes. Yes, Radical for Jesus. Yes, Tabby. Yes, Vanette. The answer is C. So I want you to consider this. You'd only be feeling for someone's carotid pulse in an emergency. When you've tapped their shoulders and they're not responsive, you're like, hey, are you okay? And you hit that panic button, that's when you'll feel for the carotid pulse, which is located in the neck. If your patient's speaking to you, please don't go and start feeling for the carotid artery. You would feel for the radial pulse, the one that's in the wrist instead. So the answer is C, which you all got correct. So great job. But let's talk about the others. The radial pulse is located in the wrist. The femoral pulse is in the groin area, and the Achilles pulse is near the ankle, so the back of the heel. Question 47. If a minor injury occurs to a resident at a group home, you should A, treat the injury and fill out an incident report. B, minor injuries are not to be reported. C, only major injuries need to be reported. D, treat all injuries, but only report the major ones. I see the correct answers. Good morning, Island Queen. I see the correct answers. So yes, the injury needs to be treated and reported, and an incident report should be filled out. So when you're taking your CNA exam, don't assume that you're in a place where nurses are just like readily available. In this image, looks like we're in the activity department today. So these ladies are having a ball. They're dancing, and if one of them should, bump into something, put a little scrape on their arm, you can go wash it off, and then you'll file an incident report, and you'll let the nurse know also. So you can treat minor injuries. If you're in the hospital, then of course you'd always contact the nurse right away. Question 48. A new resident has just been admitted to your facility. You show him to his room. What is the next important thing to show the resident in his room? Is it a telephone, the remote control, the light switches, or the call light? Always think safety. What do you want? Anna, looks like you have it. Yes, it is always the call lights. Take them into the room and show them where the safety features are within their room. And that's going to help to prevent a fall. They can actually call you if they need assistance. So the answer is D. In case a resident needs help, they need to know the location of the call lights in their room and in the facility. Don't forget to show them the pull switch that's in the bathroom sometimes, the panic switch. And that way, if they need help while they're in the bathroom and no one's coming fast enough, they can pull that cord, and then it would alert everyone within the building or within that hall to come into that room and assist that resident or that patient. Question 49. What is the most accurate method of measuring body temperature? Oral, rectal, axial, or tympanic? Which is the most accurate? Hello, Wawa. Yes, everybody, that was so easy for you. It is rectal. And usually with a rectal thermometer or a probe, you put either a protective covering on the tip of the thermometer. You more than likely would not be performing a rectal temperature unless you are working with neonates or in ICU critical care, because your patient has to be really sick for us to have to do a rectal temperature. So I want you to think about it. We're going inside of someone's body in order to obtain a temperature. Why? When we can do it, via the forehead, thermal, or we can do tympanic, ear. So I want you to think about somebody who has maybe drowned and their body is extremely cold. We can't take an external temperature. We're going to have to go in and do an internal temperature so we can help regulate their temperatures better. And in that case, usually they'll have like a heating blanket on because we have to warm them up gradually. So great job, team. Question 50. When washing your hands, you should always A, use your elbow to turn off the faucet. B, wash your hands up to the elbows. C, use a paper towel to turn the faucet off. Or D, wash your hands for 2 minutes. If you wash your hands for 2 minutes, you will not have any skin. So the answer is not D. And yes, you all, if you haven't taken your test, you all are so prepared. You're getting all of these answers right. The correct answer is C. You don't want to recontaminate your hands. So after you have washed your hands, you want to use a paper towel to turn the faucet off. Hey, Daniela. Hey, Rubianne, if I didn't say hello already. Question 51. If the resident becomes inactive and immobile, which of the following may occur? A, the resident can become depressed. B, the resident's muscles can become weak. C, the resident's lungs may become congested. Or D, all of the above. Yes, yes. So in this case, everybody, it is D. You want to get those patients up and moving, even if it's just putting them up in the chair or putting them in the wheelchair. So they can get some fresh air, maybe, face the hall or face the window so they can have a better view. But when a resident becomes immobile or inactive, all of their internal organs, their circulatory systems, and their muscles may be affected negatively. And so it's important for you to keep that resident as active as much as possible. And then don't forget passive range of motion. While you're giving them their bath, while you're turning them side to side, you move their extremities. And when you move their extremities, that helps to decrease the muscle wasting. And it also improves circulation, so they're less likely to get a blood clot. So remember, everything you do as a CNA matters. Question 52. Which of these is not an assisted device to help with ambulation? Cane, walker, crutches, or a back brace? Which does not help with ambulation? You all are correct. You're correct. The answer is D. A back brace supports the back, but it doesn't help with ambulation. So if your patient has a problem with walking, you're going to contact a nurse who contacts a physical therapist to make sure we get that walker, that cane, whatever device they need so they can walk safely. All right. And so if you haven't subscribed, this is my reminder to ask you to subscribe to our channel. My name is Nurse Eunice. I've been a registered nurse now for 25 years. I'm the owner of Florida Training Academy, and I love training my CNA, my nursing, even my doctors. I train a lot of people, and my goal is to help keep patients safe and to help make sure there are future caregivers. And so that's why I do this, and I appreciate you all for tuning in. Question 53. Which of the following would not increase a resident's blood pressure? Blood loss, exercise, anxiety, some types of medication, which would not increase a resident's blood pressure. Hey, Renee, congratulations on passing your test. Actually, Joseph, exercise does increase the blood pressure because it makes the heart beat faster. So everybody, the answer for this one is actually A. Think about someone who's hemorrhaging, someone who's losing blood. Because there's not enough blood circulating within the veins and the arteries, that means the blood pressure would be lower. So loss of blood would cause the resident's blood pressure to fall, not increase. 54. According to Abraham Maslow's pyramid of basic human needs, which of the following is not a basic human need as found on Maslow's pyramid? Is it psychological needs, educational needs, physical contact needs, or security needs? You got to think all the way back to like human growth and development from when you're in high school for this one. Island Queen? Yes, you all. I'm so proud of you. You all, Rachel, great job. It was B, educational needs. And so as we age, our needs may change, but our basic needs are psychological, such as food, water, warmth, safety, security, Our belongings, intimate relationships, our esteem, our prestige. We like to feel accomplished. And then self-actualization is achieving one's full potential. 55. Mrs. Watson is very angry. What should you not do? A. Eliminate any loud noises. B. Ask Mrs. Watson if she would like to sit down and talk. C. Speak loudly to Mrs. Watson. D. Use praise appropriately. Which do you not want to do? So this one's tricky because it has not. Yes, yes, yes. When someone's angry, you always want to de escalate. So you're never going to do C. No pointing fingers, no getting loud with the patients, even though I know sometimes they deserve it. But when a resident is upset, I need you to stay calm, move the resident to a quiet location, ask if she would like to sit down and talk, but never speak to them loudly. 56. Your charge nurse is forcing a resident to take his medication. You should do nothing. She is your supervisor. B. Tell another CNA. C. Report it immediately to the director of nursing. That's the person who's above the charge nurse. Or D. Do none of the above. Just let her abuse your patient. Yes, yes, yes. It is C, everybody. So the correct answer is the residents have rights. They have a right to refuse medication. The medication cannot be forced on a resident. Report all such incidents to the DON, Director of Nursing. And so the next video that I'm going to be doing, everybody, is it hasn't been really publicized, but there's a nurse who killed 17 patients. Her team members heard her speaking very rude to patients, and they even heard her tell one patient he's going to be next. And so that's the video I'll be shooting today. It should be posted about 2 o'clock. But she literally killed 17 patients by giving them insulin. But no one reported her. These patients are dying, and it's like, hey, she was here. She wasn't providing the care. She was really mean to these patients. And she even told the patient he was going to be next. And I need for you to be a reporter. You have to report. And if this is the DON, the Director of Nursing, who's abusing patients, I need you to feel comfortable contacting the state agency. Do not allow your patients to be abused in a healthcare system or center. I know, Sophie, that is so sad. Question 57. A resident is in shock. Which of the following is a sign or symptom of shock? A, increased blood pressure and flushed skin. B, severe headache. C, pain throughout the body. Or D, low blood pressure and clammy skin. Shock. Yes, Anna. Yes, so when a patient's in shock, usually their blood pressure is dropping and they may become really sweaty. So, this is a medical emergency. You want to make sure that you notify your nurse. And so, while you're waiting for your nurse to come into the room, you're going to keep this patient as calm as possible. But I need for you to be doing the vital signs. Go ahead and put that blood pressure cuff on the arm, get the reading, put the pulse oximeter sensor on the fingers. So by the time the nurse gets into the room, we already have the base vital signs. I just don't want you, standing there looking at a patient who's declining. You should always be in action and thinking about what will that nurse need in order to help save this patient's life. Question 58. If a resident refuses to let you take his blood pressure, you should A, report it to the charge nurse. B, take the resident's blood pressure anyway. C, tell the resident he will not receive dinner without letting you take his blood pressure. D, tell the resident he may be sick and you need to take his blood pressure. Yes, I need for you to report it. So the answer is A. And I chose this image specifically. Sick people sometimes refuse care. They do not get the sleep they need when they're in the hospital. They're hearing noises all night, IVs, alarms, and now you come in as chipper and as perky and sweet as you are, and the person says, no, I don't want my blood pressure done. Leave me alone. I need for you to try to figure out their why. Become their friend, become their advocate, and that will help you understand the reason why this person's refusing care. Maybe their favorite TV show is on. Maybe you can come back later. But in any case, I need for you to report it to the charge nurse, because while you all are doing the vital signs, most of the time your nurses are in the medication room getting the medications. And what I would hate to happen is that the nurse gives this person a blood pressure medication or a pain pill, which will cause their blood pressures to lower, and we haven't even gotten the initial blood pressure. So once the person refuses, not only do you document that the person refused and that you notified the nurse, but make sure you actually tell the nurse so that he or she can try to get those vital signs done when they're in the room with the patient passing out the medications. Question 59. Often the last sense to leave a dying resident is smell, hearing, sight, or taste. And if you were here yesterday, if you watched last night's video, this is an easy one for you. It is hearing. So you want to be very careful with what you say when you're in the room with a patient. You also want to be careful about what the family members are saying when they're in the room with a patient. I recall this one story of a patient who was in critical care, very critically ill, and he never saw his nurse's face because he was sedated. If they have a severe breathing problem so that they don't fight against a vent, we'll keep them sedated. The nurse was always saying positive things to this person. So the person ended up improving on the day that the nurse wasn't at work. And he heard the nurse's voice. And he was like, I need that person in my room right now. And he thanked that nurse for always saying positive things and for encouraging him and telling him that he was going to get better. So I need you to be that person. All right, question 60. Which of these is a device that helps transfer a bedridden patient safely? Posy vest, geriatric chair, waist restraint, or a Hoyer lift? Ooh, revealing the answer in 3, 2. Renee, F wasn't an option, ma'am. 3, 2, and 1. It is D, or Hoyer lift. And if you work in long-term care facilities, this is going to be something that you may have to utilize. And a Hoyer lift allows a person to be lifted and transferred with a minimum of physical effort. So you literally roll the patient, put a pad beneath them. The pad attaches to the crane, but this always requires a two-person team. So I don't care how short-staffed your nursing home is, you should never be using a Hoyer lift by yourself, because one person has to actually work the device as shown in this picture here, and the other person keeps their hands on the patient who's actually attached to the crane. And you can move your patient from the bed to the wheelchair, from the bed to the chair, but this is going to allow them to sit up. It also allows you to make a bed without having a person under it. I was wondering what's a good website for the practice prometric test. D'Airy, we have hundreds of practice CNA questions on our channel. And so this, if you just go to our YouTube channel, which is Florida Training, you're going to see multiple questions and also multiple skills videos. And I'll type our email address in the chat. Is admin@fltraining.com. And just shoot us an email because I'm not sure which one you're considering. And then Renee says, it was all so easy now that I've passed the test. Thank you so much for what you do. You're very welcome. You're very welcome. I was so proud of you. And thank you for updating us to let us know that you passed your exam. Question 61. A resident is confined to the bed and unable to move. How often should a CNA reposition the resident? Every 3 hours, every half hour, every 2 hours, or every 6 hours? Thank you, D'Airy. And then, yes, Anna Beverly, you all know it. You reposition your patients every 2 hours. I think it was C, but I put B here. Every 2 hours to prevent skin breakdown, which can lead to bed sores. 62. A CNA can share a resident's medical history with which of the following? A, the resident's roommate. B, the other members of the resident's healthcare team. C, the CNA's friends. Or D, the resident's friends. And we do apologize, resident is spelled wrong throughout this entire slide. I'll do better on the next slides. Hi, Rachel. Yes. Rachel, for this one, it's not C. You can't share it with their friends. Friends talk too much. It has to be B, Members of the healthcare team. And I need you to be careful whenever you're sharing confidential information. You just don't want to be in a group telling, things about patients, because one of those staff members could be related to this person that you're talking about, or they can go share it with someone else. And there are so many similarities. We all know who you're speaking of. And so you would only discuss confidential information with the people who are directly involved in that resident's care, not to the other CNAs, and make jokes. Question 63. When a nurse aide is addressing a resident, she should call the resident sweetie, honey, hey you, or by their given name. 98%, Renee. Oh, you studied a lot. No, don't call them honey. I'm seeing a lot of bees. You cannot use terms of endearment. So initially, you're going to call them by their given name. Call them by the name that's actually on the chart. And believe me, if these patients want to be called something else, they're going to let you know as soon as you walk in. Oh, I don't want to be called Susie. I want to be called Joanne. But initially, just use whatever's on the chart. Question 64. A CNA is keeping track of a resident's intake and output for the day. Which of the following must be reported to the charge nurse? A, the resident has not urinated in 6 hours. B, the resident refused his snack. C, the resident asked to use a bedpan. D, the resident only eats half of his lunch. Yes, yes. If a resident hasn't urinated, that is a sign that the resident could have kidney failure or another serious condition. So, if your patients are taking in fluids, whether it's IV fluids, or it could be that they're literally sitting there drinking water, in about 2 hours, what goes in should match what comes out. So if a person has a urinated in 6 hours, they could have some type of stricture or a tightening that's not allowing the urine to pass. They could have a stone, but please notify your nurse. We'll call the doctor. We'll get an order for a bladder scan. And a bladder scan is just this portable device. And we put gel on the patient's stomach, and it's going to let us know how much urine is actually retained. And that will be a medical reason for the nurse to get an order to obtain a catheter. So urinary retention is a reason that a patient can be catheterized. Thank you so much. God bless you and your household also. Question 65. The nursing assistant finds a piece of equipment that is damaged. She should A, store it away so no one can find it. B, fix the equipment herself. C, report the damage immediately. D, use the equipment anyway. Yes, you all, safety first. We're never going to use damaged equipment. That could jeopardize a patient's safety. It could jeopardize your safety. Also, report the damaged equipment immediately and be sure not to let anyone use it. So in most of your facilities, they will have a dirty supply room where you can put equipment that's been sold or used, not cleaned yet, but you want to take the equipment that is broken out, put it in the designated area, usually they have a sheet of paper that you'd attach to it to let us know what the problem is. And then of course your nurse will work with you to get you a piece of equipment that actually functions correctly so we don't injure you or the patient. Question 66. If a resident has difficulty chewing or swallowing, he will need what type of diet? A, low sodium diet. B, mechanical soft diet. C, clear liquid diet. Or D, bland diet. Yes, yes, yes. It is B, a mechanical soft diet. It's easy to chew and swallow and digest. And sometimes when you're the ones in the room feeding the residents and that patient or resident doesn't have their dentures, I need for you to cut their food in very small pieces, because if you try to take the food away right then, they're going to be upset with you. So what you're going to do instead is you're going to, cut the food up very small pieces. That's going to help hopefully prevent them from aspirating. And then you leave that room and you let your nurse know, hey, Eunice, Mr. Parker doesn't have his dentures and he ordered a hamburger. I'm going to go into that room, speak with Mr. Parker. Mr. Parker, where are your dentures? And he's going to be like, oh, girl, I haven't had dentures since 1992. I'm going to call the doctor. I'm going to get his diet changed because I cannot allow him to chew something that has so many layers, because it won't be safe for him. So instead of him receiving a hamburger, He'd more than likely in the future receive something like beef that's in gravy. We call that Salisbury steak, and maybe a bun. So he can still have beef, but it has to be really, really soft. Question 67. Mrs. Watson is blind. What is the best way to help her with her meals? Do you A, let her eat on her own? B, do not help her. Do not help Mrs. Watson if she asks for help. C, only allow her to eat when you are present. Or D, you want to help her by using the face of a clock, explain to Mrs. Watson where all of the food choices are located and assist her as necessary. For this one, it is D as in dog. And so if you've not been taught the clock-like pattern, if your patient lost their sight as a child, they more than likely went to the school of the deaf and the blind. And so they're taught to be as independent as possible. So if their only issue is blindness, they're not a feeder, they are an assist. If they lost their sight as an adult due to injury, glaucoma, diabetes, they should know what a clock looks like. So I'm going to expand this image again. In this image, we have the salad at 12 o'clock, the bread at 3 o'clock, the meat at 6 o'clock, and the vegetables at 9 o'clock. With the person's clean hands, you either let them touch the exterior of their plate or actually let them touch their food. And now it may be a little harder for them to eat a salad with a fork, but usually they're going to have items that they can eat with a spoon or that they can pick up with their hand. And if your blind person is successful and they can eat at least one bite of food by themselves, you leave them and you go take care of the next patient. So blind patients, you can assist when necessary, but the best way to assist them is by using the clock-like pattern and make sure their food is organized as shown in the image. Question 68. Mrs. Jackson's daughter is visiting him today. His daughter should be allowed privacy with her father, care for her father while she is visiting, only visit with her father in his room. D, never ask questions of the staff members. What do you think the best response is for a daughter who's visiting their father? Yes, you all. She should be allowed privacy and time with her father. And if the patient is allowed to go into the lobby, into the garden area, unescorted, you should allow him and his family members to enjoy that time together. Question 69. The resident has lost his dentures. The first thing the CNA should do is A, ask if anyone has seen the lost dentures. B, call the resident's dentist. C, inform the charge nurse. D, inform the director of nursing. Oh, congratulations on passing your exam. Yes, everybody. So you only inform the director of nursing when your charge nurse isn't doing her job. So the correct answer is C. When any of the residents' belongings are missing in a facility, the charge nurse should be informed first. And we're on our last question. You all know I'm going to miss you over the weekend. I pray for you. I wish you the best. Question 70 states, a resident has experienced normal hearing loss associated with aging. This is related to the ability to hear A, low-pitched voices, B, very loud voices, C, children's voices, or D, high-pitched voices. Normal hearing loss. What sounds do they have difficulty hearing? Yes, you all. The answer is it's not low pitch sounds, believe it or not. It is the high pitch sounds. It is D. It is common for residents with hearing loss to have difficulty hearing high pitched voices. So they usually can't understand what women are saying. Go figure. Lower the pitch of your voice in order to help the resident hear you. And you all, you know how I feel about you. You know that I'm going to keep you in my prayers. You have a wonderful weekend, and I'll see you in a few hours if you want to watch the video about the nurse who harmed those patients. But otherwise, I'll be back on Monday with practice CNA questions. So bye, everybody.